Multiple sclerosis is an autoimmune inflammatory demyelinating condition of the brain and spinal cord. It is seen in the US, in Europe, and in Australia. It affects females of the reproductive age group, it affects people who live in colder climates, and it affects people with vitamin D deficiency. Other risk factors include EBV infection, HHV6 infection, and people who smoke on a regular basis. Multiple sclerosis often presents with optic neuritis, brainstem and cerebellar syndromes, pyramidal tract demyelination, and spinal cord syndromes. In optic neuritis, one eye is extremely painful and there is vision loss. Along with that, there is relative afferent pupillary defect. The most important symptom is INO. INO stands for intranuclear ophthalmoplegia. Here, this occurs because of medial longitudinal fasciculus damage. Here, loss of adduction on the affected side. Assuming that the left side is affected, on a rightward gaze, the left eye cannot adduct. Two important terminologies that need to be remembered in multiple sclerosis is Lermit sign and Odorf phenomena. On flexion of the neck, there is electrical shock-like sensations that travels along the cervical spine. That is known as Lermit sign. Symptoms may be exacerbated by stressors such as heat, exercise, infection, and that is known as Odorf phenomena. One important symptom of multiple sclerosis is neurogenic bladder, and the type of incontinence that is seen in this neurogenic bladder is urge incontinence. On doing a lumbar puncture, you will find that in the CSF there is increased IgG levels, myelin basic protein, and oligoclonal bands. IgG levels are because of autoantibodies against oligodendrocytes. Oligodendrocytes are cells which myelinate the brain, the spinal cord, and the optic nerve. MRI is the standard investigation for diagnosing multiple sclerosis. On MRI, you will find periventricular white plaques which are separated by time and space. Periventricular white plaques means that you will find hyperintense lesions on T2 weighted MRI. Okay, and what does it mean by separated by time and space? This indicates that multiple sclerosis is a relapsing and remitting disorder. When these periventricular white space are around the basal ganglia, the patient will most likely have motor symptoms. In active plaques of multiple sclerosis, what happens is there is perivenular inflammatory infiltrates. So, what are these inflammatory infiltrates? They contain autoreactive T lymphocytes as well as macrophages. These are directed against myelin. So, this will lead to inflammation and demyelination. So, what does inflammation mean? Inflammation means involving inflammatory cytokines such as interferon gamma, right? So, because of this inflammation, there is damage to the blood brain barrier. What does this mean? This will lead to recruitment of inflammatory cells such as the B lymphocytes. What do the B lymphocytes do? The B lymphocytes move to the perivascular space and will cause the production of myelin specific antibodies. For the long term treatment of MS, disease modifying therapies are used. Examples of those are beta interferon, glatiramer, and natalizumab. Glatiramer is an immunomodulator, it regulates T cell function. It is a neuroprotector. Other long term therapies include vitamin D supplementation and LMTizumab. LMTizumab. This is a monoclonal CD52 antibody which kills WBC antibody. And the most effective treatment is plasmapheresis. For acute flares of MS, IV corticosteroids are given, and the most common one is methylprednisolone. For symptomatic treatment of neurogenic bladder, bethanacol is given. For spasticity, baclofen is given, and which is a GABA B receptor agonist, and for pain, tricyclic antidepressants and anticonvulsants can be used. Multiple sclerosis is a disease which affects the brain as well as the spinal cord, and hence you have both motor and sensory symptoms. When only the spinal cord is affected, you have only sensory symptoms. This variant of multiple sclerosis is known as transverse myelitis. Neuromyelitis optica. Neuromyelitis optica is a relapsing and remitting condition just like multiple sclerosis, but here instead you will have anti-NMD antibodies and aquaporin 4 antibodies in the CSF. And this is one difference. The other difference is there is focal hyperintense lesion at a particular segment.